Hello, pet parents, and welcome to another episode of Natural Pets TV. I'm joined by Heidi Nevela, Dr. Liz Bales, and Dr. Patrick Mahaney. Dr. Patrick, I want to ask you about the cat's mouth. So much goes on. It's so important to be aware of. How do you get your folks to be aware, and what should they be looking for?
It's a really good and a very important point. The mouth is linked to so many internal problems too. A lot of cat owners don't realize it, but there's a lot of disease that starts in the mouth that can affect whole body health. So what I really primarily focus on is periodontal disease. It's actually one of the top diseases that veterinarians actually see in cats. But it's a hidden disease. A lot of times cats don't really show the clinical signs very readily until there's a significant problem, or maybe they're not eating as well. They might be hiding and not interacting with the owner or with other cats in the household. They could start to chew on one side of their mouth if they have a problem on the opposite side. So there can be subtle changes that occur over time, but just kind of the basis of periodontal disease is bacteria. Bacteria grow within hours of eating or after tooth cleaning, and over time bacteria create plaque. Plaque is an invisible layer that forms on the teeth like a film. Over time it becomes yellow tartar, which becomes more visible, and then that plaque mineralizes and becomes calculus, which is like a shell that's on the teeth that has to be scaled off. Sometimes people can crack it off with their nail too, but I don't suggest doing that. So it's really critical to think about starting earlier in life to try to prevent periodontal disease, because if you don't prevent it, it advances, and it sometimes advances to the point that owners don't want to then address it because they have fear of their cat going under anesthesia. But there's never a too old to go under anesthesia. There certainly can be a too unhealthy. So I always suggest focus on the preventative side, because if you don't do the prevention, the disease will occur and it's going to just affect whole body health. So in my practice, I really stress touching the cat's mouth, lifting up the gum line, looking at the teeth and gums to see if there's inflammation of the gums, smelling the cat's mouth to see if there's a visible malodor coming from the mouth. It's hard to get people to think about actually doing it. So Liz, how do you get your clients to actually start to address their cat's dental disease?
So often in my practice, it is a visit to me. And people can have a cat that's fractious, they could get bit. So if you don't start gently and early and gradually as a kitten, or when you adopt your cat to start using treats and positive reinforcement to look in the mouth, often it ends up at the veterinary appointment, another good reason to see your vet once a year. So you want to get a good look inside, and it's not just the front teeth. In fact, rarely are the front teeth a problem. The big canine teeth can occasionally be a problem, but almost always it's those back teeth. And being able to get all the way back there to take a good look is really critical. And you were talking about plaque buildup, and that plaque actually starts to get between the tooth and gum and lift the gum in a way that even cracking it off, you might be able to get that piece off, but the problem that's really happening is under that gum line that's continually showering the body with that bacteria, and the negative consequences happen in a way that the only way to manage it, once you get past a certain point, is with that anesthesia and a proper dental cleaning with ultrasonic scaling. So in addition to that, we have the feline oral resorptive lesion.
Right.
So cats don't really get cavities like people do. There's the enamel of the teeth will form a hole, and the tooth can actually crack right off. And that's also very painful. That hole exposes the nerve cavity inside the tooth, and just touching it is exquisitely painful. And when it breaks off, it's exquisitely painful. And cats are so tough, they may not show you that, but they could be in an awful lot of pain. And that's another thing that needs to be taken care of, usually under anesthesia with a dentistry.
And unfortunately, a lot of people think that their cat's dry cat food, it's kibble, cleans the teeth, when really it doesn't have any tooth cleansing effect unless it's a very specific dental diet, which I actually don't recommend cats eat all the time, because it often contains sodium hexametaphosphate, which is a demineralizing agent, but it's not something that should always be eaten. We just don't really know, like, overconsumption of it, there could be problems inside as a result. So I always suggest that my feline patients eat human grade whole food diet, just like we eat ourselves, that are made with real meat and real vegetables and fruits, things that are of course commercially available or created by a veterinary nutritionist. But there are studies that show that cats that eat dry food as compared to eat whole food diets are more prone to developing periodontal disease, because of the film that is created on the teeth of easily fermentable carbohydrates. A lot of cat food is filled with carbohydrates like corn or wheat or soy, things that cats don't really need to be eating. So that's where I think whole food diets really fit in very well to helping to promote the health of the mouth. Do you have any suggestions from the perspective of diet?
Definitely. First, first dental care, annual checkups, absolutely, because cats are great pain maskers in the mouth. There are a couple things that, just in terms of what you brought up, that I would make suggestions for as herbal, adjunctive herbals that you can add to the diet, not to replace dental care or dental appointments. So I talked about sangre de grado fairly often, but it has a lot of uses in this regard, because not only it depends on the cat, and it depends how long the plaque or the calculi has been building up, but you can apply it to the gum line, and over time it can start reducing and actually takes the place of scaling. I'm not guaranteeing it will take it all off, but it's been pretty considerable in terms of how it will start removing some of that buildup. It's also very good at, when you're describing getting in under the gum line where it's really hard to see what's going on, because it's such a potent antioxidant and antibacterial. It might give them some palliative support and also some remedial support to the pain, and maybe even some benefit to when that's transferring into the bloodstream and other problems that can be creating downstream. For the teeth reabsorption, that we have that discussion a lot. We get a phone call a lot because it happens so often. So, and then there's another really good product I'd like to at least make a suggestion for, is Kamo Kamo, because it's instrumental in not only rebuilding bone loss and collagen production specific to teeth, eye, and those kind of areas. And it's got a nice nerve blocking natural plant chemical built into it. So just when those problems exist, those are nice things you can build into the diet that are highly nutritive. They're superfoods also. They're highly antioxidant. They have some disease preventive. They're anti-inflammatory. So really not any downside for cats. And they do all this, in terms of wellness for the mouth, they are really easy things to add in because cats like the flavor of them.
In addition to just dental disease, we also see autoimmune things that happen in the mouth.
Yes.
So there's other body systems involved, and there's something called stomatitis, where the gum tissue itself will become red and inflamed and can be very swollen and exquisitely painful. And if your cat stops eating, that could be another reason why. So it's another reason to get a good look in there and find out what's going on.
With stomatitis, well, a lot of times the remedy is to actually remove the teeth, which sounds awful to owners. Like, who wants to remove all their cat's teeth? But when they do so, they're so much more comfortable. They can eat a soft food diet than the whole rest of their life. They're a lot less at risk to felinodontoclastic lesions because they don't have teeth anymore.
It does sound extreme,
yes,
but not in every case actually, but in most cases it is what is necessary to resolve the problem.
And the anesthetic dental, part of one of the really crucial parts of the dental is our x-rays. X-rays of all the teeth, full mouth x-rays, so we can actually see what's going on under the gum line, because that periodontal ligament that creates that good attachment to underlying bone becomes weakened over time. You may not see it, but there could be that weakness that's seen on x-ray, and that means that tooth actually should be extracted. I work very closely, fortunately, with a veterinary dentist, and a lot of my patients go under anesthesia with the veterinary dentist, so this is a person who works exclusively in the realm of dentistry, has really the most knowledge as to what to do with particular teeth. Should we remove it? Should we try to fix it? What can we save? What can we clean? So I really recommend making sure your veterinarian, if you're doing a dental, is actually x-raying the teeth, because it gives you so much crucial information that could really affect your pet's outcome for a long time.
In addition, we can also see cancers in the mouth.
Yes.
And unfortunately, most of them are pretty bad news. But it's good to know what you're dealing with and manage pain and nutrition until we can't manage it anymore.
Absolutely. So the mouth, crucial place. Focus on it early in life. Work with your veterinarian on a regular basis during that annual exam, or more frequently. Take daily steps to do home dental care. Make it a habit, just like you would do yourself. Mm-hmm. I brush my teeth at least twice a day, sometimes more. I don't have a dog anymore, but when I did, I would brush his teeth every single night, and I kept his mouth incredibly healthy for many years.
Well, there you have it. Be proactive, be vigilant, work with an expert. Thanks for joining us here on Natural Pets TV. Hey folks, thanks for joining us here on Natural Pets TV. So many great topics, so many wonderful experts, but we want to keep the conversation going in the comment section down below. Let us know what you think. Let us know what you want us to cover in future episodes. And if you want more information, you can always reach out to us at petworldinsider.com, or for more information from our guests, you can get that for Heidi Nevela, Natura Petz with a Z.com, for Dr. Liz Bales, NoBowlCat.com, and for Dr. Patrick Mahaney, PatrickMahaney.com. Thanks for joining us, and we look forward to seeing you again soon.